Well, Blurring the Boundaries is a report that really seeks to bring together the many policy developments and legislative changes that have occurred over the last 20 years in mental health and criminal justice. And it seeks to understand where and how those two fields are coming together, are converging, which can be both of benefit to people in those two systems, and there are also a number of risks that we've identified that can occur as a result. Lord Bradley's report last April in 2009 highlighted 82 recommendations for change in the mental health and offender context, and really was the culmination of 2 decades of developments in this area. Blurring the Boundaries seeks to look at some of those areas in more detail and to highlight really at this stage in the process where we feel some checks and balances need to be in place in order to avoid some of the risks that may be down the line if mental health and criminal justice continue to converge. So the report looks in detail at half a dozen specific areas. Criminal justice mental health teams or liaison and diversion services were highlighted by Bradley as being very important to the future of the criminal justice and mental health field. We also look at mental health courts, both the US-style standalone courts and also the mental health court pilots that have been running in this country for just over a year. We look again at community sentences, specifically the mental health treatment requirement, which is available as part of the community order, and imprisonment for public protection, the indeterminate sentence brought in 5 years ago, which has now seen nearly 6,000 people receive it, and with some mental health implications. There are 2 new areas that we look at in quite a lot of detail. One is the hybrid order, the hospital and limitation direction, which as a result of changes in the last Mental Health Act in 2007, became available for use for someone with any form of mental disorder. It enables a judge at the point of sentencing to order someone to hospital for an indeterminate length and at the same time pass a prison sentence. And this has the potential to revolutionise the way that offenders with mental health problems who would be going to prison otherwise may be dealt with in the future. And finally, the last area that we look at in detail is the Dangerous Severe Personality Disorder Programme, DSPD, which has been one of the longest running and most expensive pilot projects in UK history. It's cost nearly £500 million over 10 years, but the evidence for its effectiveness has been limited, and some would say has actually in some cases caused more harm than good. We unpick some of the growing research around DSPD and make some recommendations as to how that money might be better spent in future. There are a number of benefits to convergence, to the coming together of mental health and criminal justice services and policy. We've seen major improvements over the last 10 years, in particular with the introduction of in-reach teams run by the NHS into all prisons. That's undoubtedly raised the level of care for offenders in prison. We've seen better information sharing between agencies and better working together in the community between different statutory bodies who traditionally would tend to work in silos. Some of those have been because of statutory demands such as MAPA, multi-agency public protection arrangements, which by law every local area now has to get involved in. And sometimes it's been through better relationships built over time by keen individuals. We've also seen a major strategy come out from the government at the end of last year, Improving Health Supporting Justice, which sets out a 5-year timetable for change in line with Lord Bradley's recommendations. If that were to be implemented, it would be of major benefit to both professionals, clinicians and people on the receiving end of either mental health or criminal justice interventions. There are, however, a number of risks to ongoing convergence. There's been a rise in what we have termed preventive detention measures such as IPP sentences and DSPD, and we look at some of the risks of that of those sorts of interventions becoming more prominent in the future. There's also a danger that converging the two worlds will blur the professional boundaries between health staff and criminal justice staff, and that a hybrid professional would reduce would make it less effective in the community, would make services less effective in the community. There's another danger that a dual label of criminal and mentally ill would increase stigma for offenders with mental health problems, which would be unhelpful in long-term rehabilitation. And concern that hospitals, particularly forensic secure hospitals, are becoming increasingly like prisons, and actually that hospitals should be fundamentally different to a prison. Its primary purpose should be to provide treatment and care, and should not be first and foremost around punishment. The role of the prison and the hospital need to remain distinct, despite the heightened recognition that that security and risk must be always a priority. And we must ensure that minority groups such as black and minority ethnic offenders and women and young people are not further marginalised by two giant fields such as mental health and criminal justice coming together and forgetting to make sure that they are sensitive and tailored to specific needs of minority groups. The prospects for the future are that convergence looks likely to continue, those boundaries will continue to blur, and as Lord Bradley states in his foreword to the report, the question as to when convergence should cease and to how far we should let it go is a question we must continue to ask ourselves as we go forward.